So I had a little time last night staying down at Little Italy, and I tried to practice my sort of Valley Girl, you know, West Coast sort of accent, and well, this is it. So I appreciate your hosting me. You know, is Dr. Hauser still here, or did she need to leave? I appreciated so many of her remarks, but one of the things when she was talking about blame and mentioned President Bush, I would just like to say that as a speaker, roaming around different parts of the country, it's particularly difficult on the West Coast and in the Northeast. You know, with George W. being in the White House and President Phil self-appointed as the nation's psychologist, it's just very hard being a Texan right now. So I'd appreciate any charity. You know, it's not like I went to college with these men, and I'm not responsible for their behaviors and choices, and I just wanted to issue that up front. I'm going to be talking about challenges and choices. I'll talk about challenges first, despite what you see on the title slide, with the goal being really addressing my remarks primarily to the key primary caregiver in the family unit. Sometimes that's an adult child, oxymoron, but still, you know what I mean. More often, the challenges that I face as a consultant for these families is when the primary caregiver is a spouse of someone who has Parkinson's disease. So a lot of my references will be in that vein. Be talking about trying to maintain some sense of balance, some sense of purpose in your work as a caregiver, and it is a job. It is a very rewarding job. One of the things I remember NPF publishing as a slogan one year was the hardest job you'll ever love, you know, for a caregiver series. But it is difficult in maintaining a sense of humor. Now, she alluded to in several ways that Parkinson's was a complicated chronic disorder. Of course, all of us think of it as a movement disorder, but in so many ways, it's just much more than that, and I wanted to just sort of do that. One of the challenges with Parkinson's is that the fact, as she mentioned, that the symptoms are very unpredictable. It is, you know, on and off, varies not just by the day, but by the hour. I find in primary care work, it's very hard for physicians to even understand that. So do you go to your family doctor and your complaint is, well, he can take out the trash on Tuesday, why can't he do it on Wednesday? You know, and it's just the kind of thing. Doctors are particularly bad. I'm going to talk about the public a little bit, but I see in two specialty lines that are frustrating to me as somebody who does know a bit about Parkinson's disease, when people go to the dermatologist, and rarely ever is the oily skin, the dandruff, the flaking around over the top of the ears and eyebrows. That's hardly ever. And the dermatologist will actually say to people, oh, that wouldn't have anything to do with your Parkinson's. You know, and they really know very little about it. A scarier example than that is podiatry. Now, I have a lot of respect for podiatrists. Everybody knows that's the foot people. You know, well, one of the ways that their major income streams is foot surgery. So oftentimes I've had more than one time where a patient has been scheduled for hammer toe release for surgery because the podiatrist did not know that that downward curling of toes, the dystonia in the morning, was simply their Parkinson's. So if you could cure something with a little extra Cinemat, you know, as opposed to foot surgery, wouldn't that be a lovely thing to know? So I see part of the role of caregivers, as well as patients, of course, in this case, is educating the healthcare community around them as to just what Parkinson's is. It's not just the public, although, as she said, you know, you can be arrested, you know, carry a card that says, I have Parkinson's, I did not just finish 3 martinis. You know, my balance is due to the Parkinson's disease. A lot of times when I mention to people just casually, like on the airplane or something, that I work in Parkinson's disease, they'll either say one of two things. What would you think I'd hear back? Oh, that's what Michael J. Fox has. Everybody, he and his wife have just done a tremendous public service for our collective community in public awareness about this healthcare condition. But the other thing they'll say is, oh, that's where people get really demented, right? They confuse it with Alzheimer's. So another case where you're constantly, like George W. being in the White House, having to explain yourself and what your symptoms look like or what your spouse's symptoms look like. The prognosis is uncertain, as she mentioned, in early years. People with the tremors as a predominant feature are folks whose Parkinson's moves slowly over the early years, rarely start to gallop later on. So those are nice predictive features, but you don't know for a while. And so the second thing everybody asked after, well, why me? How did this happen to me? Is, well, what will it look like? What will it feel like? How will I be? And nobody can answer that for you for the first couple of years. So that's difficult for people, and one of the real challenges with that. Okay. I never know if it's my voice or if the people sitting in the back are the ones who can't hear. Like in the Baptist church, it's always the people on the farthest pew that have the worst hearing. You know, I thought that was just a religious connection for a long time. But now that I've been on the lecture circuit for a while, I think there's something there both ways. Like those arguments in the exam room where the Parkinson person's saying, my spouse can't hear, and the spouse is saying, you talk like this. You know, so you never know here. As I mentioned, I'm going to focus mostly on primary caregivers. I like this one where she says, oh, for God's sake, just bring me the dirty dishes already. So there is a challenge to personal privacy when one person in the house has a chronic illness such as Parkinson's. All of us need some personal space and private time, and I find that that gets more so as I get older. And when I watch my young people, I'm sort of help raising a couple of grandchildren. Agreed to that in a weak moment. But anyway, and they want to be with their friends every second or on their phone or texting. They want no alone time. Alone time is that dreadful time between 2 and 4 a.m. when their body just collapses and they had no choice in the matter. Well, I'm long past that. And the patients that I work with and the families all need some private time. And neither retirement or chronic health conditions lend themselves to your getting a smidgen of time alone during the day. I love that old AARP thing that says, I married him for better or worse, but not for lunch. The other thing I see a lot talking with couples is when the relationship is shifting, when you are going from being truly a life partner to maybe a coach or a hands-on caregiver. I'm not talking about the people who just go to caregiving seminars and help make some more executive decisions in the family than they used to. I've started talking about those real personal things that none of us want somebody else to have to do for us, to feed us, to bathe us, to help us with toileting. You know, those things so disrupt the normal interaction in a marriage, for instance, to use that, traditional example, that it interferes with everything else. It interferes communication. It interferes with personal intimacy needs. One lady put it poignantly to me a few years ago. She said, we used to sleep spoon fashion. It had nothing to do with having sex. She said it was just, we would sleep back to front. Y'all know what I'm talking about, spoon fashion? And she said, it just shrivels me up now. I can't cuddle up to the depends. She's talking, now that's a little funny, but not much, so it's an agonizing time for a lot of people trying to maintain some privacy and dignity needs. One of the challenges of taking care of somebody with Parkinson's disease is it is often exhausting. We think of exhaustion as being physical because it takes so much energy to keep the body running when you're 2 quarts low on dopamine. And to do all the things, if you are the spouse of somebody who's 2 quarts low, then I refer to that. You have to be about 80% depleted before a doctor can detect your symptoms, right? She said it was a clinical diagnosis this morning. But it is more than just physical exhaustion. There's a real emotional exhaustion component to taking care of someone with Parkinson's. And that's particularly difficult if there's dementia involved. She didn't have a lot of time this morning. Dr. Hauser did not have, it's hard for me not to call her Melissa. I'm old. I'm like 20 pounds past, 20 years, 20 pounds too. So 40 pounds in 20 years farther north in life than Dr. Hauser is. And I worked with her father out in Florida for a while. So it's very hard for me to remember to take all this seriously. Nevertheless, when she was talking this morning about exhaustion and the dementia thing, she didn't have time to focus a lot on the aspects of that. But probably our estimates have been low. In order not to frighten the community in the early years, I think the articles in the old days really minimized the percentage of people who developed significant cognitive deficiencies.